Welcome back to the third episode of IVF Unplugged, the honest voice for aspiring parents. Infertility is a growing challenge in India, affecting millions of people. According to the Indian Society of Assisted Reproduction, ISAR, nearly 27.5 million people in the country face infertility-related issues. Lifestyle changes, environmental exposures, undiagnosed medical conditions, all of that have contributed to this rise, highlighting the urgent need for awareness and destigmatization. The journey to IVF often begins well before the first injection or procedure. It starts with the preparation phase, a crucial stage where you ready your body, mind, and plan for the path ahead. Building this strong foundation not only eases the process but can also influence its outcome. In today's discussion, we focus on this vital pre-treatment stage. Together, we'll explore what aspiring parents can do to simplify and strengthen their journey towards parenthood through IVF. Please join me in welcoming Dr. Bhavna Banga, Director, Fertility and IVF, Cloudnine, which is a leading fertility specialist who will underline the importance of a holistic approach to IVF. So let's get started. Dr. Banga, welcome on board.
Thank you, Karanya. So let's shoot your question.
Sure, let me get started. From a medical standpoint, what are the most common diagnostic tests and assessments that you recommend before creating a personalized IVF treatment plan?
So to answer that, let's divide our patients into two categories. One is a patient who would be initiating the IVF cycle for the first time, and the other who has already undergone an IVF or any fertility treatment earlier. Because the treatments, the protocols, the approach varies depending on what the patient has undergone in the previous cycle. So let's go with vertical A, when the patient is just embarking the journey for the first time. For that, I would like to know what is the age of the couple, for how long have they been married, do they have any addiction, like smoking, having hookahs, etc., alcohol consumption. Do they have thyroid imbalances? Do they have sugars? Do they have any sexual dysfunctions? So this will help me to understand on what test I need to advise them. So let's understand that the couple is between the age group of 30 to 35 years. I would advise them. Simple test I need. One is called AMH, that is an anti-Mullerian hormone. It is a cycle-independent test. It can be done at any stage of the menstrual cycle. Say if the patient comes on day 10 of the cycle, she need not wait for day 2 or day 3 of the cycle to get this simple test done. It is not to be done during the fasting. So this is a very important message I want to give to my viewers, my audience, that this test is not cycle independent. This test is cycle independent, so you can just get it done anytime. One. Then I would like to cross-check this result with one baseline ultrasound of the woman, which is a transvaginal ultrasound. And this is cycle specific, which is done basically on day 2 or day 3 of the cycle. Third is a semen analysis, which just needs an abstinence of 2 to 5 days, where we check the sperm count, motility, morphology. And I would order some tests like a complete blood count, and just to check the hemoglobin is right, the patient does not have any infection, a thyroid profile, to check the sugar. Sometimes the patients are there on a pre-diabetic side, sometimes cause. So probably we could find these tests, and based on this, we formulate an individualized protocol in terms of what medications to be used, what is the dose of the medications, what complications or what challenges can I foresee after reviewing these results. So this is for those patients who are embarking the journey for the first time. These are the basic tests required. Obviously, we need the blood groups, we need the thalassemia profile, that we will take it on later on, but these are the basics. Now, let us look into into another vertical where the patient has already had an unsuccessful fertility treatment, be it an IUI or an IVF. So, for that, what information do I need to extract or absorb from the patient? So, that would depend again at what age the IVF was done, what was his sperm count, what quality of embryos were formed, was it a fresh cycle, was it a frozen cycle, what day the embryo was transferred, was it a day 3 or a day 5 transfer, was a PGTA done, was the sample testicular retrieved, or it was an ejaculate sample. Based on this, I can formulate a more personalized protocol for these patients. So one size does not fit all. So IVF processes are not like, you can just kind of keep swiping for all patients the same thing. So for these two examples of categorizing the patient, it is very clear that individualization is key to optimizing the reproductive outcomes.
Okay, got it. Doctor, male infertility is often a significant factor, though it can be overlooked. According to ISAR, it accounts for about 40 to 50% of infertility cases. Now, what key assessments are important for male partners during this preparation phase?
So yes, as rightly said, that male contributes significantly to the fertility concerns. So what thing is often overlooked is the abstinence period from the time the patient is entering the IVF or any fertility program. Ideal abstinence means the patient should not have ejaculation or masturbation, should be around 3 days. Anything less than that, not so good. Anything more than that, sometimes they are 10 days, 12 days, there is a month even, because by the time they're starting the cycle, they have not been sexually closed. So we are so much focused onto the woman that we ignore the man. So what do I tell my patients? That whenever we are starting with the injections, we start on the second or third day, a man should masturbate or ejaculate the sample, his semen, into the restroom every third or fourth day, so that we have a fresh semen sample on the day of egg extraction. 1. 2. Alcohol smoking, specifically smoking, if feasible, if possible, should be avoided for minimum 3 months prior to embarking the journey. But however, this cannot be just taken as by saying as a blanket statement. Sometimes the age of the woman is very, very important. So in those cases, we do not have these strict criteria that 3 months we need to wait, and then only we can take the patient into the cycle. So everything is again I'm pointing out that it is individualized. So alcohol, smoking, abstinence period, if the patient needs to be on certain antioxidants, then the patient should just take for 2 to 3 months. If there is no improvement, there is no point extending up to 6 months. If there is some hormone imbalances and then we need to give certain medication, it is just 2 to 3 months. And after that, we assess. If there is no improvement, we just leave it and then we jump into the advanced technologies.
Okay, got it. But what recommendations around lifestyle would you suggest for aspiring parents in the months leading up to and even during their cycle to manage their physiological and mental stress that potentially could build up before and during the IVF process?
So my mantra to my patient is that think what can go correct rather than what can go wrong, because there are so many myths around the IVF treatment process. There are so many injections, the babies can be formed with certain malformations, some abnormality, I will put on weight, the injections are for so many days, doctor, and I will have a mental breakdown and emotional outbursts and blah blah blah. What I tell is that IVF over a period of time means, what I say, that the first IVF baby is already 47, 48 years of age. So this is a time tested technology. It is not over the sun just immediately, it's just coming to the process. There has been numerable changes into the programs in terms of the type of medications, the specialization to optimize the results. There are very patient friendly protocols which have come. There are specialized doctors like us, like I'm a gynecologist, but I have not delivered a child for the last, say, over a decade and a plus. I just deal with fertility patients. Once they get pregnant, they go back to the gynecologist to deliver. So what is this highlighting is that the doctor is there who is mentoring and baby holding the entire process. So one, you need to go to a doctor who is doing exclusively fertility work and not doing deliveries and the fertility and a bit of laparoscopy. So please go to those units. Second, the injections are very patient friendly, so you can take your injection by yourself. Third is that if you feel the doctor, I need some time to prepare myself. Yes, if your AMH is good, means it is in the range where what your age should be expecting, and then you can take some time, like 2-3 months, to prepare yourself in terms of regularizing your thyroid, your blood sugars. If you have put on some weight and you need to, shell off 2 to 4 kgs weight, you can use that time. You can do medication, and so you're just preparing your body for that. But mind you, if you're advanced age, like 41, and then you say that, doctor, I'm very scared, or husband's sperm counts are on a very, very low side, and then in those cases we say that that you don't have time, you just need to embark the journey ASAP, because the age of the woman is overpowering all the mental wellness you're trying to gather, because what we are going to create it out of the eggs, what we are going to harvest. So if you don't have good quality eggs or the good quality sperms, we shall not be successful in forming a good quality embryo. So age of the woman is very important, and this is guided specifically by a dedicated fertility specialist. It's not from a gynecologist even. I have seen patients who are 41, 42, 43, they are onto lifestyle modification. That is not going to work, because first we need to have the eggs which are already 40 years of age. When you're 40 years, means your eggs are 40 years old. So that is egg aging. They are not able to multiply properly. So you are anyway onto the negative side of the treatment cycle. So such things need more proactive approach. And this sensitization is very necessary, but it is often very difficult, because there are 10 people telling, no, prepare yourself, only then you will get a better result. They are not wrong completely. But at what stage is the couple entering the fertility program? Even that determines how much time they can take for themselves to prepare.
All right. But let's say if someone conceives naturally, does that mean they will never need IVF? On similar lines again, if they have once failed the IVF cycle, does that mean it will never work with them again? If you could kind of demystify that for us.
Yeah. No. It's a very good question. And what I want to tell my viewers is that, see, first we need to understand that what is the indication for any IVF or a fertility treatment. Is it a relative indication or is it an absolute indication? So what do I mean by a absolute indication? Absolute indication is that the couple has got negligible chances of getting pregnant naturally. I mean by that, where the fallopian tubes are blocked, the sperm counts are extremely low, then there is advanced maternal age. So then once IVF would always be an IVF because of these parameters. Other is the relative indications. That means it is unexplained on the surface, where the tubes are open, the sperm counts are normal, the patient is young, but still not able to get pregnant. Then in those cases where it is relative, you are doing IVF because you have tried certain cycles of IUI, ovulation, induction. You have given yourself time to conceive naturally, but still you're not able to get pregnant naturally, but your other parameters are fine. So in those cases, once IVF is never an IVF again. I have seen patients of unexplained infertility who have failed negative IUI cycles, IVF cycles, and then they have conceived naturally. You need to even understand that the reproductive biology is not absolute. Nature is not very forgiving. The human reproduction is poorest into the everyone. So we are very dysfunctional as compared to the other species. So once you understand the biology, you will be more receptive to the outcomes of the fertility treatments. And who is going to explain you all this? Not Google, not your gynecologist, nor your parents, friends, etc., etc. It is your doctor. and she has to baby hold you. So I call my patients little babies. I have to baby hold them because they are like magnets. They get easily attracted to things whatever suits them, not what is science. And obviously, God is there, but then those are anecdotal cases, one in some thousand. So they cannot be made practice guidelines.
Right.
Yeah, please go ahead.
Do you think early planning for IVF, can that save the emotional and financial burden? And how can young couples plan their fertility journey better for those of the young couples that are watching the show?
So first we should know what is definition of young right now. For me, young, I mean the patients which come to our clinic or the facility, the young is 35 plus, which is not actually young. They are already onto that declining phase of fertility, because by the age of 35, we have only 25,000 eggs which are functional, and they are of getting into suboptimal quality. So the ideal age for fertility is what? If you'll be shocked, it is around 22 to 25. So that's what our great grandparents or grandparents would say, ki jaldi shadi karo, marry a younger girl, she could have a better fertility outcome. So that time I would think it is a patriarchy. Ki, oh, you want a man to always dominate a woman, so you want a younger wife. No, the biology, so what our culture is seeing is to a certain extent correct, that we can get pregnant by the age of 12, 13. That's why we have teenage pregnancies, because the biological clock starts from the time you're having your menses. So once you say that you are 30 years of age, so you're already around 15 years plus behind the biological clock. So the nature, as I said, is not very forgiving. So the nature says, I have started my clock at 13. Now, if you don't want to get pregnant by 14, 15, it is not my headache. So the eggs do not look at your age, your organic food, your Pilates, your yogas. Nothing works on that, because the age is programmed of the egg. So the couple probably into the late 20s, 28, 30 would still be a good time where you're kind of semi-settling into your life, and you should always remember that everything can be settled or taken care of, but the fertility. Because unfortunately, 30 to 40 is the time where we are struggling to capitalize our career and the opportunities. At the same time, it is a very limited period for the fertility. So I would want to tell all the females or the ladies who are watching the program, there is a huge price we pay. Sometimes being a woman is the fertility window, because the men think, oh, there is a lot of time, so just chill and relax. But you have to understand that it will not affect their fertility, because a man can make a woman pregnant even at the age of 80 or 90 years, because his sperms are forming every 3 months. You need to take the charge of your own situation. You can always get settled on even later on in life, because what I have understood, all the girls who are into the IITs or who are aspirational for their careers, if you do not want to get pregnant, at least do fertility preservation. If you're married, you can create an embryo and then freeze the embryo, and then you can transfer after say 4 or 5 years whenever you're good to have a child. If you're unmarried, please freeze your eggs, because you're not sure when are you going to get married, or you're not sure about your partner. So there are many options. Now it is just depends that how much charge of your future fertility do you want to take as a couple or as a woman. And if you're recently married or newly married, you can just get a simple semen analysis done, a simple blood test called AMH, and an ultrasound done. Then at least you know that the doctor will guide you, okay, Baba, your fertility is okay. You have 2 to 3 years window. Don't worry, nothing will go wrong. But if you're to the declining side, she will put a red flag. Okay, don't do this. We shall give you options. So one more thing, what do people think, that if you go to a fertility specialist, they will just do for you IVF? This is the biggest myth. You have to understand that the dedicated fertility specialist with a lot of subject specific knowledge can see beyond boundaries, can see the invisible, which we all are not able to see, because we have handled these patients. We know science, we have studied so much. So what happens is that the fertility doctor is the only one who's talking different. Rest all are talking the same language. So the patient gets gravitated to that. Okay, पेरेंट्स विल से कि डोंट वरी, भगवान ने हमारा अच्छा ही करा है, हमारा अच्छा ही होगा. All this doesn't work because our parents have not crossed that journey. You cannot talk to your friend who already has 2 to 3 children and she cannot guide you onto the fertility program. You need to speak to like-minded people who are undergoing a similar journey, a similar challenge into the fertility journey. You need to talk to a doctor who has got immense knowledge of the subject. It's not all doctors are fertility experts. Some may have some limited knowledge, some may not at all have. We have got so many patients coming with gynoveda and some homeopathic treatments or some religious belief. Belief, it does not work in most of the cases. You need to come to an expert, take their opinion, and then you can take this as an additive parameter, not as an absolute parameter.
Well, Doctor, on that note, we'll conclude this conversation. Thank you so much for joining us on IVF Unplugged, the honest voice for aspiring parents, powered by Merck.
Thank you. Thank you for having me here. Thank you for your
And
patience.
to all of those watching, we hope today's conversation has given you clarity, comfort, and confidence as you take the steps on your journey to parenthood. Remember, every story is unique and you're not alone. Until next time, take care.